What is neuroleptic malignant syndrome? Neuroleptic malignant syndrome is a life-threatening adverse reaction. It is most commonly resulting from the use of antipsychotics neuroleptic medications, which block dopamine receptors in the brain. Symptoms of neuroleptic malignant syndrome: high fever over 40 degrees Celsius, confusion, generalized muscle rigidity, autonomic instability, which include variable blood pressure, sweating, and fast heart rate. Complications may include rhabdomyolysis, high blood potassium, kidney failure, or seizures. Neuroleptic malignant syndrome has been associated with virtually every neuroleptic agent, but it is more commonly reported with the typical antipsychotics like haloperidol and fluphenazine. A 25-year-old man is brought to the emergency department after being found unresponsive. He has a history of schizoaffective disorder and previous suicide attempts by prescription medication overdose. The patient was recently started on haloperidol and sertraline. Temperature is 40.6 degrees Celsius, blood pressure is 180/98, and pulse is 112. On examination, the patient is obtunded and diffusely rigid without clonus. Laboratory studies show serum creatinine of 3.2, creatine kinase of 75,000, and leukocytes of 16,000. This patient has neuroleptic malignant syndrome likely caused by an overdose of haloperidol. The antidote dantrolene inhibits calcium ion releasing from sarcoplasmic reticulum of skeletal muscle. Neuroleptic malignant syndrome presents clinically with diffuse muscle rigidity, high fever, autonomic instability, hypertension, tachycardia, and altered sensorium. Laboratory findings include creatine kinase elevation due to rhabdomyolysis, which can result in acute renal failure. The mainstay of treatment is to discontinue the causative agent and provide supportive care, for example, intravenous hydration. In severe cases, dantrolene can be administered, which antagonizes ryanodine receptors and inhibits calcium release from the sarcoplasmic reticulum. Bromocriptine, a dopamine agonist, has also shown clinical benefit in neuroleptic malignant syndrome. Activation of presynaptic voltage-gated calcium channels at the neuromuscular junction will trigger calcium influx into the terminal bulb. This will increase the release of acetylcholine from the terminal bulb onto the muscle end plate and, therefore, promote skeletal muscle contraction. Serotonin receptor antagonists, for example, cyproheptadine, can be used to treat serotonin syndrome. Similar to neuroleptic malignant syndrome, serotonin syndrome can present with altered mental status and autonomic instability, diaphoresis, hypertension, hyperthermia, and tachycardia. However, serotonin syndrome commonly presents with hyper-reflexia and myoclonus, not diffuse rigidity, and gastrointestinal symptoms: nausea, diarrhea, vomiting. Myoclonus refers to sudden, brief involuntary twitching or jerking of a muscle or group of muscles. Blockade of central dopamine D2 receptors in the brain leads to the extrapyramidal symptoms, for example, diffuse rigidity observed in neuroleptic malignant syndrome. Inhibition of acetylcholinesterase results in increased acetylcholine at the neuromuscular junction. It is promoting skeletal muscle activation and contraction. Procholinergic agents should be avoided in neuroleptic malignant syndrome as they may exacerbate symptoms. Neuroleptic malignant syndrome is a life-threatening reaction to antipsychotic medications characterized by diffuse muscle rigidity, hyperthermia, autonomic instability, and altered sensorium. The antipsychotic should be stopped and supportive care provided. Dantrolene, a ryanodine receptor blocker that inhibits calcium release from the sarcoplasmic reticulum, is an effective antidote.